What is the true cost of all-on-4 procedure? Today we're going to be talking about, why some places you go to for dental implants and wanting to get this procedure done for all-on-X. Why is it, one place one price and another place another price?
So first of all, you're always going to want to consider what you're getting in that office. There's going to be a lot of questions that you need to ask, the different type of materials that are going to be used, what all is included in that package that you're getting. Is there going to be a warranty included with it? So those are just all key items that we wanted to focus on today, and hopefully we can answer some of the questions that may be on your mind.
So today we're going to be talking about 4 key points about why it's more expensive one place and why it could be cheaper another place. And as far as a patient and a buyer wanting to get this procedure done, it is very important that you consider all these 4 factors.
So when considering an office, you're going to want to also consider how you feel when you go into that office. How are you being greeted? Are they getting you back? How professional are they when they talk to you? How confident about what they're doing? Do a little bit of research on those offices. Check out their webpage. See how many reviews they have, if the doctor is board certified, and see if you can learn a little bit more about who is working in that office for you.
The first factor we're going to be talking about is the price. Okay, so the price in some offices from just locally from here in Dallas, Texas, can range anywhere from $25,000 to $30,000 per arch. There are some offices that are also advertising it much less than that, for like $10,000 to $12,000 per arch. But you kind of have to be careful because it's not always apple to apple in what you're getting and what they're guaranteeing or warranting.
A lot of times when you go into these offices, you're going to have, for the cheaper option, they'll advertise it as somewhere maybe around
$12,000.
Yes, but we do offer that here in our office as well, but it's a different type of material that you're going to be getting. So when you see that doesn't necessarily mean you're going to be getting the zirconia material, which is more known and more durable for a long-term solution when coming to the all-on-4 prosthetic. But there is an option that is a little cheaper for those who are a candidate.
Right. So, some places will advertise it much cheaper for like $10,000 to $12,000 range, as Erica mentioned. These offices often are just putting patients in interim, partial or fixed bridge, where it's just acrylic only. Some offices are using similar products. It may not just be acrylic; it could be something else. And also you have to look at the warranty that they're offering. This is a very invasive surgery, and it's meant to be long term. So if they're offering something very short term for you and just to get you by, you want to really consider what the cost will be long term.
You also have to consider if you're going to be a candidate for that. If you are interested in doing something that you just need something to function, you want to be able to smile, have a little bit more confidence, just depending on everybody's situation, there are key factors that go into that. So you're going to have to take into effect, are you a clincher and a grinder? Like, why did you start losing your teeth to begin with? Because not every material is made for every person. So once you come in for your consultation and the doctor is able to take a look, we ask a little bit more questions, we look at your x-rays, we can determine whether you're going to be a candidate for the acrylic option versus the zirconia option. And again, not everybody is a candidate for the acrylic option.
Exactly. All right, so we're going to talk about factor number 2. Factor number 2 has to do with the dentist that's doing the surgery. Are they oral surgeon? Are they specialists? Are they board certified? These are all factors that will determine, what you're getting and what kind of service and quality, and also minimizing the risks of getting these procedures done.
You would definitely want to ask your doctor how many implants or cases have they done. Most of the time, if they've done quite a few, you're going to see testimonials, you're going to see reviews talking about on their website about the work they've done, and that's all things that you want to take into consideration, because there's a lot of doctors out there that can place an implant, but not everybody is as comfortable and is able to make sure that you're going to get those long-term results that you want from the get-go.
Yeah, there's a lot that goes into this type of procedure. Doctors placing single implants here and there in their offices, they may have the greatest experience in doing that. But to do a procedure where it's like basically, where you have to take into consideration your whole mouth, your bite, your occlusion, your smile zone, There's a lot of things that go into that to give you the best smile possible and be able to function properly, not just for now, but something for many, many years to come. So, you want to go to a dental office that the dentist has that experience and has been proven day in, day out to provide that level of service for their patients.
Being a doctor that does the all-on-4 procedure is there's a lot more that goes into it. It is really more of an engineering process. There's so much that there's so many dynamics that go into it. The quality of the bone, the implant placement, where you're able to place those implants, and basically just figuring out exactly the bite function, making sure that people are going to be able to chew correctly, being able to make sure they're going to be able to pronounce their words correctly, because all of that goes into play when having this done.
If you want more information about All-on-X procedure, and we do offer a free consultation at our office, please click the link below, and then we'll be able to get in touch with you to get you scheduled for a free consultation.
Our hours are pretty flexible, but somebody will always be able to reach out to you pretty quickly. So call our office at 469-625-0005, or click the link at the bottom and somebody will get in touch with you right away to get your appointment scheduled.
All right, let's talk about number 3. The materials used. Erica briefly mentioned about the acrylic and then zirconia. I want to spend a little bit more time talking about what these materials are. So some of our patients that come in to have this procedure done for the All-on-X are coming in, that they currently have either a partial that's removable, or they have come in because they've had a denture for so many years and they're just no longer, it's no longer fitting and they're not happy with it. So the acrylic option is similar to that. Instead, the only difference is that it is screwed in with the implants versus just being held in with suction. The temporaries that are made initially for these patients that in our office, we do make it out of acrylic just because we don't want the patient to chew anything hard or crunchy, because we don't want to either test the new implants that were placed, because it does take time for that implant to get integrated with the bone in the patient's mouth. And in order to do that, we got to make sure that they stick to a very soft diet and just basically be careful for the next several months out as they're healing. Now, as far as long-term prosthetic or what they're getting, again, these offices that are offering a cheaper option, you got to really be careful. Okay, why is that? If they're offering, for example, zirconia at a cheaper price, usually you are going to be getting a shortcut. And in dentistry, especially with this All-on-X procedures, there's really no shortcuts to give you something that's strong, that's going to last you for many, many years.
When considering acrylic versus zirconia, you're going to want to think about long term. The zirconia prosthetic is made to last a lifetime. It is pretty much unbreakable. It's going to give you the luster. It's going to give you the cosmetic aesthetic appeal that you want when you're smiling in pictures, and it's going to be the next best choice to having your own natural teeth. The acrylic option is going to be more to just get you by. It's going to be more to just give you the function that you need, but you're not going to necessarily get the luster or the more natural effect and the aesthetics of the natural teeth as you would have had with the zirconia. So when you're thinking about this, you also have to think about the forces that you're going to be putting on these, and that there is going to be chance of breakage or repairs, just like a regular denture. Okay, we do reinforce the inside with a titanium bar, but that still does not mean that it is not unbreakable.
Yeah. So, patient getting in the All-on-X with acrylic option, usually the short-term cost will be less because of just the material being used, less labor, less work being done on it. But the long-term, cost may actually be higher because of all the repairs. And once it gets to a point where the teeth are worn down because they're acrylic, they're softer, you probably have to have the prosthetic remade, and those costs will add up very quickly over a period of 5 years or so. So in our office, we only offer as a long-term solution. We only recommend the All-on-X zirconia prosthetic because it's much more durable, it's much stronger, and it can withstand the test of time. So with the chewing and the eating and everything. So.
Let's talk about maintenance, Dr. K.
All right. So a lot of offices is kind of all over the board as far as maintenance. Some offices only do the surgery. Then you have to go to another office to have the restorative part of it, the prosthetic, the fixed prosthetic made. So sometimes when patients have issues, where do they go to? Do they go to the doctor that placed the implants, or they're going to go to the doctor that placed the restorative part of it, which is the part where the teeth are, and then acrylic and zirconia are. So you want to really go to an office, in my opinion, that does it all in one place, because you'll have the peace of mind that if you have any issues with anything, or even not issues, you just go there for your follow-ups every 6 months or once a year. Every office again has different protocols for that. All I can speak for is my office. We do highly recommend you come in every 6 months. So that way we can take x-rays of your prosthetic, of the implants, make sure everything is functioning well, your bite is well, you're doing a good job with the maintenance cleanings at home, as far as making sure you're using a water pick correctly, brushing, and just the normal things you should be doing as far as maintenance. Because sometimes offices are focused so much on getting the surgery done and getting the patients done that they don't really stress the take-home, the at-home hygiene, and that is very critical. So
what we hear a lot of is, especially in people that have had this procedure done in other states throughout the US, is they were never informed that there is a lot of home care maintenance that goes into this. So if you want to have long-term sustainability, it is best to go to a place where they do everything. If you're going to get your implants, it's just like buying a car. You get a warranty with your car. They want you to bring it there so they can check it, make sure everything is running accordingly. And that's basically what we do here. So you're going to come in every 6 months, just like when you had your natural teeth. We remove the prosthetic, we check the screws, we check the parts, we make sure we take x-rays, make sure there's no bone loss around those implants. And we always want to try to catch things before they happen and make sure that if there is an area that you're not diligently cleaning, then we can tell you and have you focus more on that area and monitor it. We want you to have the best long-term solution that's going to last you, and we want you to be successful as well. So we're here for you in that way, and we will take care of you from start to finish.
I hope this video was informative for the true cost of All-on-X and why is it so different in pricing in one office versus another. If you found this video helpful, please like us on YouTube and Facebook, and also please click the link below and contact us for more information. We do offer free consultation at our office, and we'll be happy to set the time to sit with you and discuss your particular situation and how we can help you.
And one more key point to add, if you have family members, we are a full service office. So if you're interested in implants and maybe you have kids or you have a wife that needs to be seen, but they're in a different situation, we can see the whole family here. So just give us a call or click the link. We'll see you soon.